Breast cancer is the most common cancer women get, and there's some very exciting things happening with breast cancer. One is that we are able to find the breast cancer very early now compared to in years past. When cancer is found early, it is more easily cured, and there are a greater number of options for treating it. The first thing is to see the surgeon, and he'll talk to you about a mastectomy versus a simpler surgery to just remove the lump. And in almost all cases, women don't need to have mastectomies anymore. They can have the lump removed and preserve their breast. There are also some very exciting advances in radiation therapy. We know from the women who have chosen not to have radiation at all that if the cancer comes back, it comes back right at the same site it was in the first place, right along the edges of this lumpectomy cavity. We now have ways with radiation of targeting the radiation to just that spot. These treatments are called breast brachytherapy. There's many versions of breast brachytherapy. The simplest versions place a balloon inside of that cavity where the cancer was. We then send a very intense radioactive seed to the very center of that balloon. The radiation source stays in that balloon for about 10 minutes, and it gives that rim of tissue all the way around where the cancer was a radiation dose needed to kill any stray cancer cells that might have been left behind after surgery. This kind of radiation treatment with a brachytherapy balloon can be completed in 5 days. External radiation, which is the older version of radiation for breast cancer, was a daily treatment that took 7 weeks. So these new brachytherapy treatments are more convenient for women. They tend to have far fewer side effects because only part of the breast is treated instead of the whole thing. And studies show them to be every bit as effective as the external radiation treatments, as long as certain appropriateness criteria are met. To qualify for breast brachytherapy, the breast cancer needs to be small, about 3 centimeters or less. A second criteria that must be met is that the surgical margins around the cancer need to be clear. This means when the surgeon goes in and takes out this cancer lump, we want a rim of normal tissue all the way around that lump removed as well. The other important cancer feature that has to be met in order to have breast brachytherapy is that there needs to be very little, if any, cancer involvement in the lymph nodes up under the arm. Part of the surgical treatment for breast cancer is going to be removing the cancer lump, but also taking a sampling of some lymph nodes from under the arm. If cancer has involved a lot of lymph nodes under the arm, then a much bigger area is at risk for cancer recurrence, and these small focused brachytherapy treatments in that case wouldn't be recommended.